move it back. And he's going to use an EPA-registered disinfectant cleaner on that sink. Okay, now Dave's getting ready to do the floors. The first thing he's going to do is put a wet floor sign at the door. The next thing he's going to do is move the patient's property off the floor as much as he can, and then he's going to dust mop, working his way across the room in a figure 8 until he gets back to the door. The next thing he's going to do is wet mop, and he's going to do that in the same manner, working his way back and forth in a figure 8 until he gets to the door. Last thing he's going to do is put the patient's property back where he found it, leaving the floor nice and clean and the patient's property in its rightful place. Dave's going to start in the bathroom the same way he did by the sink in the patient's room. The first thing he's going to do is check to make sure that there's paper towels, toilet paper, and soap in the dispensers. Then he's going to check the shower curtains, moving his way on to the sink. When he gets to the sink area, he's going to use glass cleaner, and he's going to clean from top to bottom, hitting the light and the mirror and the paper towel dispensers. Then he's going to clean the sink, and he's going to use an EPA-registered disinfectant on the sink. When he's done with the sink, he's going to move on to the toilet. He's going to use a toilet bowl cleaner first, inside, and that toilet bowl cleaner has a flip top cap on it so he can reach under the rim. He's going to use a toilet bowl swab to get under the rim of the toilet, and when he's done with that, he's going to use an EPA-registered cleaner disinfectant to clean the outside of the toilet from top to bottom, and then he's going to flush. When he's done with that, he's going to move on to the walls, and he's going to kind of spot check the walls. He's going to use that EPA-registered disinfectant cleaner, and he's going to wipe them down top to bottom, making sure to hit the heavily soiled areas. Then he's going to move into the shower, and he's going to do the same thing, working his way around the shower in its entirety. When he's done in there, the bathroom will be nice and clean.
Hello, I'm Ben Guerrero.
And I'm Angela Husky.
Today we will be demonstrating how to properly clean a non-isolation patient room. The items Angie will be using will be a microfiber mopping system, housekeeping cart, personal protective equipment. The chemicals she will be using will be an EPA-registered disinfectant cleaner, toilet bowl cleaner, approved cleaning detergent for floors, glass cleaner, stainless steel wipes. All approved chemicals can be found by accessing the EPS website. She will also need some cleaning supplies to include scrubbing pads, trash bags, linen bags, disposable Johnny Mop with holder, cleaning cloths, and wet floor caution signs. Angie will also be restocking items to include paper towels for the dispenser, toilet paper, hand soap and hand sanitizer refills, and customer service tent cards. So Angie, what is the first thing you do when you enter the patient's room?
The first thing I'm going to do is don on my proper PPE, my personal protective equipment. I'm then going to take a look around the patient's room to make sure there is no loose trash or debris on the floor. I'm going to move over to the trash can to remove the waste.
In order to reduce the risk of potential exposure, Angie never compresses the trash. Instead, she pulls it from all four corners, keeping it away from her body. Once Angie has pulled the trash, she then uses an EPA-registered disinfectant cleaner to clean the outside and the inside of the trash can. Angie then raises the bed to an appropriate level. She removes the headboard and the footboard and begins the cleaning process using an EPA-registered cleaner disinfectant, cleaning from top to bottom, ensuring that the bed stays wet for the appropriate dwell time. She cleans both sides of the mattress and the frame of the bed, ensuring that she wipes down all cracks and crevices. She wipes down the side rails and handrails, as well as the undercarriage of the bed.
It is important to change your cleaning cloths routinely as they become soiled.
Angie then wipes both sides of the pillow, wipes the headboard and the footboard, and replaces them on the bed. Once the bed is washed and thoroughly dried, Angie makes the bed in preparation for the next patient. Continuing in her counterclockwise cleaning fashion, Angie wipes down the outside as well as the inside of the bedside table using her EPA-registered cleaner disinfectant. She visually inspects the curtains for cleanliness and cleans the window using the approved glass cleaner. Angie will clean the sink area using an EPA-registered cleaner disinfectant, starting from top to bottom, wiping down the top of the lights, the mirror, the wall, the back of the sink, the faucet handles, the faucet, and the inside of the sink. She will pay special attention to wiping down the bottom of the sink as well as the pipes. She will then use her glass cleaner to wipe down the mirror. Finally, she will visually inspect paper products and the soap and replace them if necessary. Angie visually inspects the sharps container to make sure that sharps are not past the fill line. If they are, she replaces it. She then uses her EPA-registered cleaner disinfectant to wipe down the outside of the sharps container. Anytime that you're mopping the floor, make sure to use a wet floor sign. In order to remove loose debris, Angie dust mops the entire floor. She then uses her microfiber mopping system with approved floor cleaner to mop the floor in a figure-8 motion. Angie will continue the cleaning process by wiping down the sink area with an EPA-approved cleaner disinfectant. She will start with the light and work her way down, wiping down the mirror, faucet, handles, and sink, paying special attention to the underside of the sink as well as the pipes. She will then use the approved glass cleaner to wipe down the mirror. Angie will visually check the soap dispenser as well as the paper towel dispenser and replace as needed. Angie begins the toilet bowl cleaning process by flushing the toilet to remove any loose debris. She pours the toilet bowl cleaner in the toilet and begins cleaning from top to bottom using her EPA-registered cleaner disinfectant. She wipes the outside, the seat, and the underside of the toilet. She then scrubs the inside of the toilet using her Johnny mop. She then flushes the toilet and closes the lid. Angie will continue the bathroom cleaning process by wiping down the walls, as well as the vertical and horizontal surfaces using her EPA-registered cleaner disinfectant. She will wipe down the nurse call button, as well as the inside of the showers, paying special attention to the handrails. She will also check the curtains to make sure they're not visibly soiled and wipe down the vinyl curtains. Anytime that you're mopping the floor, make sure to use a wet floor sign. Angie will then use her dust mop to dust mop the entire floor. Once she has completed the dust mopping, she will utilize her microfiber mopping system and approved floor cleaner to mop the floor.
The next area we're going to discuss is the hemodialysis suite, and we'll talk about the unique situations that the housekeeper will encounter in this area. I'm Kai.
And I'm Tree.
And let's discuss Tree's equipment and his cart that he'll be using. We have the dustpan and broom, his microfiber mopping system, his high dusting system, his EPA-registered disinfectants, and his personal protective equipment.
And Kai, don't forget the all-important putty knife.
What would be the first step in cleaning a hemodialysis suite?
Well, the first step that we do is to make sure that I police up the area to remove any loose debris and to make sure that I pull linen and strip the beds, or if in the case of your dialysis, set up the chairs.
Then what would you do?
The next thing I want to do is pull trash. I want to make sure that I pull my trash and dispose of it properly.
Would it be okay to remove the trash from the receptacle and just put it into my larger trash can?
No, 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 no. That is never a good practice. Never reach into a container to pull out loose debris. Always pull the entire liner and then inspect the inside of the container for any spillage or loose debris. Once that is done, then you want to make sure that you clean and sanitize the outside as well as the inside of the container.
What would be the difference between a primary clean and the end-of-day cleaning?
Good question, Kai. With the primary, we are focused because the patient is present. And if the patient is present, we want to focus on our patient-centered care initiative. We want to introduce ourselves as we enter the room or the unit. We want to make sure that we explain our purpose there, the amount of time that we plan to spend there. We want to repeatedly apologize for any inconvenience that we may be causing. And we're going to do a quick spot check of the floors for any spillage or any loose debris. And we may pull trash if necessary.
And the difference between the primary and end of day, what would you do for the end of day cleaning?
Well, at the end of the day cleaning, we do a terminal cleaning. What we're going to do is focus on the entire dialysis unit, any flat top surfaces to include the bed or chair, whatever your unit is set up. We're going to include any equipment that is dedicated to that room. We're going to focus primarily on the cabinetry of the equipment. We're going to make sure that we inspect our cubicle curtains for any debris or tears. If we do discover any, we will replace the curtain. We also set up a quarterly inspection where we repeatedly inspect the curtains and we pull them on a quarterly, and we're going to pull trash. We're going to clean the inside of the liners, the outside of the liners, and that is the difference between a end of the day and a primary.
And what would be the last few steps that you'll have in hemodialysis?
The last thing that we're going to do is we're going to address the floors. We're going to dust mop the floors, and we'll start from the back of the unit, and we're going to include going between the equipment, underneath the beds or chairs. We're going to move the dialysis machines and the equipment so that we make sure that we get any corners or behind or any debris, and we're going to dust mop out into the unit. Then we're going to repeat the same process with a wet mop. We'll again start at the back of the unit. We will wet mop. We will interchange our wet mop pads as frequent or as needed until we completely wet mop the entire floor. We want to make sure that our floor care signage is up at the beginning, so to make sure that we are alerting all that we are in the room servicing.
Hi, I'm Eric, and I'm here to talk about the invasive cleaning procedures that take place in procedure rooms and ORs.
Hi, I'm Nathan. I'll be the trainer.
And it's the responsibility of all medical centers to provide a safe and clean environment for all patients, but especially those having invasive procedures. That takes a team effort of perioperative nurses, surgical technicians, environmental management staff, and infection control professionals. That's governed by hospital policy and procedure.
These hospital policies and procedures are written by the facility and approved by the infection control. Eric, can you please tell us a little bit about the in-between case cleaning and the end-of-day case cleaning and the differences?
Sure. For the purpose of this film, we're going to be talking about in-between case cleaning. That's going to involve the zone where the patient is and 2 feet out on each side. There's a second type of cleaning that takes place at the end of the day that would involve the same level of disinfection and cleaning, but would have additional duties for restocking supplies. After the invasive procedure has been completed and the patient has been removed from the room, all the furnishings in the patient area where the procedure was completed is then turned over to Environmental Management Service for cleaning and disinfection.
Okay, first of all, you want to make sure you've donned the proper attire. Then you want to make sure you have the proper PPE on, beginning with the booties. Then you've got your gloves, you've got your hairnet. Then you want to make sure you have your mask. Then moving on to the cart, you want to make sure you have the right items on the cart, starting with the biohazard bag, your general waste bag. For this purposes, we're going to be using a disinfectant wipe. If you do not have disinfectant wipes, make sure you've got an EPA registered disinfectant. If at all possible, please use a microfiber cloth. Then you want to make sure you have your additional gloves. And finally, you've got your microfiber mop head. After that, you want to do an inspection on the cart, making sure that it's clean and ready to go into the room. It looks like it is, so I think we're ready to roll.
Following environmental management services taking the room and ready for cleaning, and after the patient and equipment's been removed, there's a series of tasks that take place. In this case, Nathan will be collecting our waste stream and textile stream. What Nathan is doing right now is preparing the infectious waste stream bag by tying off the corners prior to transporting it to the soiled utility room, where he'll leave it in a container for transport. He'll wash his hands and don new gloves. Following Nathan removing and disposing of the regulated medical waste, he'll survey the room to see that there was nothing left behind that belongs in the general landfill waste. If so, he'll collect it and he'll put it in the container. This is much like the same process that we will use for collecting linens and transporting them to the soiled utility room as well. In each case, there's caution shown to keep the materials away from your body. Environmental Management Services is responsible for the cleaning and disinfection of the room where the invasive procedure took place. What Nathan's doing right now is cleaning the high-touch surfaces by using a disinfectant disposable wipe. The disinfectant disposable wipe has a shorter dwell time and requires to be changed out frequently, using many of them during the process. Nathan's direction of work is from the top down as he moves from the high-touch surfaces and moves to horizontal surfaces. He'll change his wipe frequently to meet the 2 to 5 minute dwell time. In most cases, the dwell time for the product to reach the kill claim is 3 minutes. What you see Nathan doing right now is doing the horizontal surface of rolling stock that was used during the procedure. Following that, he'll move to the patient bed where he'll begin cleaning the mattress on both sides and the hard surface that the mattress lays on. During the cleaning process, he'll also inspect for any rips or tears that might be a compromise to the field where the invasive procedure takes place. As Nathan moves through on both sides of the mattress and the hard surface, his work direction will take him from the top of the mattress in a downward direction, finally ending at the bottom of the table. As Environmental Management Services continues to clean